I think it'll make it easier. Thank you, Katrin. Thank you very much, everybody. It's good to see you all this morning. We're just going to take our seats up front here. It's tempting to speak loud because you think that, you're in a big hall. But technology is incredible, right? You can hear me as I speak at a moderate level. Thanks, Katrin. My name is Christine Mundo and I'm a journalist. And as Katrin rightly said, we're looking at big data and AI, digital technologies, and how these can help us and protect us from health crises. We're just coming out of a pandemic. In so many ways, we're still taking stock. What just happened, right? That 2 years where our lives were upended. But we know that if we harness the power and opportunity that technology offers us, we can protect the global community from these global threats. And we're really looking at it specifically through the lens of global health. We can see the threats, the challenges, but we can also see how we're able to address them. And what I'm particularly excited about in this panel is that we're looking at equitable digital transformation. So not digital transformation that benefits one half of the world at the expense of the other, but really coming together. And so what you'll hear from the speakers that are with me today is the aspect of international cooperation. That's important because as we saw, these global health threats are not hindered by borders. They don't necessarily adhere to passport control, so to say. So we really have to come together and harness the technology that we have. We've got representatives from different stakeholders up front with me, from private sector as well, because we need all stakeholders to come together in this aspect. And as you'll hear, there are sensitivities in this conversation. We're talking about data, we're talking about health. These are really sort of personal issues. So all stakeholders are needed so that we do this not just in an equitable way, but in a just way, in a fair way. So I want to now introduce my speakers to you all. And I'll start right out far over there. That is Nina Bekele. She is with Google, who we all know. And she specifically is working on the social impact and product partnerships team. She'll tell us a little bit more about what they are doing over there and how it relates to our topic. And Mary Mbole Kariaku is with the African Union, and she, amongst other things, is project lead for the One Health Data Alliance Africa, as well as the Inter-African Bureau for Animal Resources. And she'll also expand a little bit about that. And closest to me is Anna-Sophie Herken, and she is Managing Director at GIZ or GIZ. And of course, you know that they have this big footprint when it comes to international cooperation, right? So taking our efforts and scaling them up. And I guess, Anna-Sophie, I really want to start with you here because we're asking, who cares here at Republica 2024? But how does this theme relate, Anna, to the work of international cooperation, specifically in the context of digital transformation? Because I know that's a big part of what you're doing at GIZ.
Yeah, thank you very much. I really like the theme, not only because it has a question mark, but also because who cares really challenges us and also us personally to really think about what are our responsibilities when it comes to digital transformation and the global situation. And usually I always try to come from opportunity spaces. I always think, there's so many great things to do out there. And then looking at the numbers, you just say, okay, 4.9 billion people globally have access to the internet. Yeah. That's great. So they can be part of a digital revolution. And then you look at the United Nations estimates that say technologies could probably contribute to about 70% of achieving sustainable development goals. Yeah. And that's great, reducing poverty, improving access to healthcare, and so many other things. And then on one hand, so we have all these opportunities, but when you say like more than half of the world's population has access to internet, it means nearly half does not. Yeah. And if you look at sub-Saharan Africa, about 70% of the people do not have access to the internet. So I think this digital divide issue is really, really relevant, and this is why at GIZ we work a lot on digital transformation. And I thought perhaps I give you a very specific example, because we're not only talking about digital transformation, but also about health. Yeah. So in Nigeria, 2016, there was a health crisis, pandemic response was not, there was no preparedness, there were challenges all over. So what we did is we worked with local developers to implement a solution called SORMAS. It's like a surveillance, outbreak, management, monitoring system for health diseases, pandemic situations. And it's a great big data solution. And what it did actually, it enabled health workers in remote areas to track pandemic outbreaks or health outbreaks, which was a total game changer in Nigeria. And it was a local solution. I think that's also important. What we do is we tailor solutions to the local context, which is really, really important. And it was so successful that later when COVID-19 hit, many European countries adapted that response mechanism. And I think that shows there's so much potential to do things. And this is why I really believe in digital transformation for the global health problem, and I very much look forward to our discussion today.
Yeah, thank you so much for that, Anna, because there is a very beautiful example about how we can learn from each other as a global community, because as you were saying, these surveillance sort of methods that have been adopted on the African continent were really helpful to countries in Europe and other sort of developed countries around the world. Mary, I want to come to you now because we know, as we heard, that digital innovations are already being used by the global community. But let's talk about AI now, because that's really the buzzword. Can you talk to us about AI-based approaches and the role that they play in detecting health risks at an early stage so that we're able to sort of contain disease risk in good time?
Okay, thank you so much, Christine. So I think I'll just start with really driving it down into the African context, the African Union context. And really just presenting something that has been very critical to Africa, coming up with strategies like the African Union Digital Transformation Strategy, which drives the agenda on AI. But the critical question that we need to ask ourselves is, how is Africa going to take up AI? Yes. That is the starting point, because we can set up very good systems in place, but the African continent has to be really ready to drive that agenda of artificial intelligence. So think about it. So we have a strategy in place, but do we have the structures in place for AI? That is the most critical action. So that when Africa is moving, we are moving together. Anna has said it very well. There's a certain percentage of Africa that doesn't have access to internet connectivity and digital actions. So how do you push that agenda when the foundational work is still weak? So this is where we need to really come in and push an agenda that will be really positive for Africa. And allow me to just say that when you talk about AI and the tools that are available, we first need to build capacity, not only infrastructural capacity, but human capacity. Because when you drive human capacity, then the African continent will be able to say, oh yes, AI means something to us, and we can use it to inform what we want to do. So I think the buzzword needs to really be put in the African context first, before we take the next step. And I really am glad to be part of the One Health Data Alliance project that is funded by BMZ and technically supported by GIZ. We are working very closely with Dr. Christine. And what do we want to do? Yes, we want to drive AI, but we've taken time to come up with simple issues. For example, a One Health information policy, something that was passed by the heads of state, and that will drive AI. So we have an endorsed information policy that will push an agenda on the information architecture first and develop a platform. So it really needs to be very strategic and sequential so that we can actually have something out of what we are going to do. Even if we put infrastructure in place and the capacities are not well built for AI, then I think we will be, what we say in the African context, like pounding water in the pestle, So we need to really have something that is really strategic, that will build capacities. We welcome AI, and I want to use one reference we've seen. Recently, the Vice Chancellor of the University of Nairobi, I think he's called Professor Patrick, came up with the first AI program. So they're going to train technical students, university students, on understanding AI, using AI, and then that way we will build forward. So I think the foundation needs to be very strong before we push an agenda on AI in a very blanket kind of statement. Then that way Africa will be able to benefit from AI and the benefits that it comes with. Even if we say, AI-sensitive policies, what are we really saying to the African continent? What do we really want them to understand from there? That AI is not ChatGPT. AI goes beyond that. You can do predictive modeling, that the data that you get actually makes sense. The big data we are talking about can be used with AI-powered tools to do what? To generate evidence, to inform us, to be prepared for health disasters, and that way we'll have sustainable solutions. So I think it really needs to be very strategic for us to move forward.
Right. And again, it's so when we have this data, right? It's what do we do with it? Because if you have all this data and you're not sharing it, it can only take you so far. So in the context, perhaps I'll come back to you because it's actually something that Mary sparked in the context of sharing data. And how important is that we share data across countries, across sector? How important is it that we do that effectively in the bid to prevent these pandemics and global health risks?
That's what I can just follow up on what you said. The One Health approach is and I think COVID has shown it that pandemics in the future will spread from animals to humans. So far, we're already struggling with the data we have sort of in the health sector. And then you have the animal health sector, the environment, climate. So each silo by itself is a huge challenge. But if you really want to be effective, we need to sort of have cross solutions. And that's extremely challenging. And at GIZ, for example, we work with you, we work on approaches on the data exchange. It's not only about exchanging, it's also about reading the data, doing the right analytics. But also, again, it's between countries, it's between sectors, and it's between organizations. So it's pretty challenging, but important.
Absolutely.
So, you're agreeing, Mary. That
Absolutely,
this is important,
absolutely.
But, one has to think about where are the risks here when we're talking about now we're sharing, sort of health data at that level, right? Maybe talk to the role then that international cooperation plays, that other stakeholders like the private sector, the public sector, what role then do they play, civil society as well, to ensure that there's trust in this data sharing, right? We agree that it can make a difference, it's important, but there are risks. What then do multi-stakeholders play in making sure that that is a safe space?
Christian, thank you. So I think this is really critical and really coming from an African perspective where sharing of data is something that is very sovereign. Every time you ask for data, they say, data is sovereign, it's our data, and they're very cautious about doing this. So we do have a data policy that actually propagates harmonization, data integration, data sharing, okay? That is there, but we need to operationalize it. How do you build trust for every other country to say, I can give you my data and you will not condemn me for having a trade-sensitive disease, for example? So because of that economic risk of data, we tend to keep the data to ourselves, very cautious about what you want to say and how you want to present it. You remember during COVID, after South Africa picked, I think, a new strain,
they got border closures.
Good, good. So they got border closures. That was data sharing. So I think we need to create a situation where data can be shared safely without, of course, you'll have some consequences, but the consequences need to be in a safe space without impacting the economic situation of a country. And we've been trying to come up with data sharing agreements at the African Union level to say that we can share data, but how much will I give to you and how much will you integrate and how much will you look at that data? So again, data sharing is it's a good thing, but I think it comes with some consequences. It's really walking on thin ice, though that is what we need to encourage. Data integration, data sharing, and that's what we are doing. Let me go back to our One Health project. That's what we are doing. So we are sharing. We want to encourage countries by showing them, how you share data is by giving feedback to the country, and they get, it means something to me. It doesn't mean that I'm going to be disadvantaged, but rather it will make me make an informed decision that will build on my country. So that's what we are doing. We've set up a feedback loop. You can get back feedback. That is what we want to do. Build data analytics. And when you have feedback, then you will share the data much easier. And then you'll have the regional economic communities sharing data, because it means something positive towards evidence-based policies. And then the international community comes in. So I think the sharing of data should be in a positive framework, as opposed to always looking at it in, you have this, you need to, stay away from that situation.
Such an important aspect, and this is why really we were trying to bring in the diverse voices to make you understand, because if you're sitting in this part of the world, you don't understand what the implications are for a country on the African continent or somewhere else in the developing world, the consequences that come with making public certain information. So we've got to meet each other at that place where we, as she's talking about the feedback aspect, where this becomes a helpful exercise, a beneficial exercise, and not just a potentially punitive exercise. I keep using the word exercise. Okay, so Nina, you've been sat there listening in very carefully. Oh man, data in the private sector. But I know that you're coming at this from a very different perspective in the work that you're doing at Google. Look, we cannot get around the private sector with this one. Companies like Google that you represent here today are important in being brought into the effort of data for the common good. So my question to you then becomes the role that the private sector has to play in this aspect, in generating data for the common good, and how players like Google are intensifying their commitment in this space.
Thank you very much for the wonderful question. Let me just quickly drop my headphones. Do you remember the last time when you had a specific health condition? Most likely you were Googling your symptoms online. So the majority of health journeys actually don't start at a doctor, but they start with you most likely looking online into your symptoms and how you can possibly treat these symptoms as well. So
sometimes I even get a diagnosis.
Sometimes you find information around the diagnosis, potential treatment, vaccination, and more. So we at Google, we receive these requests or search queries around health information more than hundreds of millions of times per day. So we take this particularly serious within our efforts within Google. So when we look particularly in the area of disseminating information in the circumstances of a global pandemic, as we've been speaking about, there are different ways how we focus on this and enabling global health initiatives. So we focus on the users, the caregivers, and the communities. Particularly when we look into the users during the COVID-19 pandemic, we've been looking into how can we make authoritative information more accessible to the billions of users to make informed decisions on their health. So for example, we've been partnering with the World Health Organization to surface reliable information and also fighting mis- and disinformation on COVID-19 and, for example, vaccinations. We've been surfacing this across our products like Google Search or YouTube. Another aspect that we can look into in providing data for the health space and empowering communities is through aspects like our COVID-19 mobility reports. We've provided insights into highly aggregated mobility information, showing on providing policymakers and researchers the data necessary to elaborate and to explore how effective social distancing efforts were, or how effective also efforts were around stay-at-home measures. And another example that we can look into is Google Search trends information. So I've just mentioned how people most likely look on search engines around their symptoms. We have a tool which is called Google Trends, and this tool provides information, again, on an aggregated level on what people are actually looking for and what keeps them busy. looking into, for example, disease information, like I lost my taste or I lost my sense of smell. This kind of information can be used by policymakers or by researchers to detect symptoms of diseases early and look into predicting, for example, the next outbreak of the COVID-19 pandemic or a specific health condition. So there are several ways how we can leverage data across the private sector and make this more accessible to inform caregivers, users, and communities for global health initiatives.
Mary, how can we ensure that we protect data sovereignty? You talked about the sort of how countries in the African context sort of feel about it. This is ours. What are you going to do with it? How do we sort of protect data sovereignty in the African context? And maybe if you could just follow on from what you've heard there from Nina in terms of, do you have that at a huge scale? I know internet penetration is one thing on the African continent, but how helpful can private sector players be in that context as well in Africa?
Yeah, absolutely. Thank you, Christine. And I just really want to take up from Nina what you've just said. I've seen that Google has tried to come up with different African languages, I think 160. Good job. Yeah. So they're reaching out. Exactly. So it becomes something, the go-to. And we always say that when you get home and you ask yourself, what have you diagnosed yourself with? We say Dr. Google. Yeah, because we always go to look for symptoms. So how can we really give data sovereignty? I think it's basically about what that data becomes. And I've said it before. Even if my data is sovereign and I know that the data is going to contribute to a positive growth to my country, then African Union member states will have no problem with that. For example, let me say, when we talk about the cloud system, we've been trying to convince member states that it's okay as AU-IBA, we can put the data in the cloud system. No, they're not comfortable with that. They want you to put it in a physical server because that is... So I think we need to drive an agenda of awareness, creation, and that your data is safe with us. It is actually something that we'll build upon, that we can say, oh yeah, we need to improve on getting better services using data as a service. I think that's the bottom line. Data as a service, not as something that we're going to crucify you for having in your system. Actually, what we've picked from member states, and this is even multi-sectorial, even within member states, sharing of data. For example, let me talk about the One Health component. Sharing of data between animal health, human health, environmental health is a challenge. It is a challenge in the same country. So data integration, even in the same country, is not as easy as we want to take it to be. So I think what we need to do is to establish systems that will really develop confidence in terms of your data is sovereign, but sharing it with us will actually help you to move forward. For example, I can share data on the capacity of digital skills, and Google can come in and say, you know what, we're going to build your systems in terms of digital skills. GIZ can come and say, oh, okay, clearly your the digital innovation is questionable. Can we step in and plug in and grow that hub even better? So it's going to be something that is informative, that is forward-looking. That's the best approach for me to when you talk about data sovereignty, because you have to be very careful about what you share. That lack of trust is the problem, and the misinformation.
Yes. Right.
Data produces misinformation sometimes when you get it wrong.
And perhaps we need to come back to that one, if you would hold that thought. Anna, you've got this great vantage point in the sense that you've also, worked at sort of private sector level and now in sort of more international cooperation at a sort of public sector level, if one can call it that. Listening to Nina over there, you can clearly see that, the private sector's role is important here in terms of tackling our current challenges when it comes to global health. From your perspective, what role do you see the private sector playing or should be playing?
it's playing a key role because we need innovation, we need the funding. So I mean, like, there's no sustainable change in global health if you don't work with the private sector. So I think that's extremely important. And at GIZ, we also work with the private sector. I mean, like, we in the corona pandemic, we just developed a chatbot, Baza, together with the private sector and local startups and the government. So I think there's so many great examples, and it's sort of unthinkable because we really need to team up. And as much as we have to work like on the data part, beyond borders of sectors, of regions, of governments, we have to do the same when it comes to private sector, non-profit, governments. So it's too big. Yeah, the global health crisis is too big to not cooperate. And perhaps also one addition to also what you both said is I think it's so important. I think you called it the system of confidence that we get this right, because I have to actually say I only learned also from my preparation today that we sort of gathered an unprecedented amount of data during the COVID pandemic. Yeah. And I got a number which I never heard before, 2.3 zettabytes. I had no idea what zettabytes are. Apparently it equals like the storage space of 15.3 billion smartphones.
Wow.
That's just the data we had by 2020.
Wow.
And it's estimated that by 2030, 30% of all the data out there globally will be related to the global health sector. And then there was another number that struck me, which is 97% of the health data we have is totally unused.
Absolutely.
And so I think if you see all these opportunities, we have to make sure that we get the foundation right now so that we can start using all this data. Just imagine we have a world where all the data flows seamlessly between countries, organizations, sectors. And I think this shows why it's so important that we get like the basics, the regulatory part right. Because there's so much data out there that will be really great if we can use it right, together with the private sector, with governments, with everybody.
So Nina, 97%, that's an astonishing number, unused data. And I think it begs the question around cooperation between the private sector and the public sector. How can we foster that so that we make data exchange and data sharing easier?
Yeah, absolutely. Thank you so much for the wonderful question. I'd like to elaborate on what Annette just mentioned. So something that is particularly striking when we look into this number, like 90+% of health-related data being unused, this number is most likely even higher in Africa. So what we're seeing is we're having a couple of challenges, particularly in this area, and limitations that make it very difficult to share data. So one aspect that we're focusing on is obviously the connection to the internet. So you've elaborated on this. So, for example, when we look into my home country, Ethiopia, only 19% of the people are connected to the internet. And internet connectivity is crucial to provide data, to generate data, and make it more accessible. So this is one aspect that we need to focus on, internet connectivity. Another aspect, and that's also what you've mentioned, is around the digital skilling and the human capital. How can we train people to actually also make use of this data? And then another aspect is around the data standards, enabling technological innovation. So something that we're seeing particularly in Africa is public by default is for public data, open by default for public data is not the norm. So we see that national governmental statistical offices most likely have their data behind paywalls or behind login walls and not necessarily have this available under Creative Commons 4 on a public level. And if it's available, it might be in a very difficult format. It's very difficult to access it. So when we look into public and private partnerships, there is an opportunity to work together with the private and the public sector to address these challenges. So how can we promote physical infrastructure? How can we promote digital skilling? How can we look into educating around the benefits of open and public data?
Absolutely.
And then lastly, also looking into the regulatory environment. So how can we promote also open markets and a competitive environment in this space as well? Something that is particularly relevant here is also having a looking into regulations, particularly in the field of AI, it's incredibly important that we look into a productive and safe regulatory environment. But we also need to see that we're not too scared, that we're still enabling innovation, and that we create an environment that promotes also the upside of innovation in this space. And I think that's where the private sector plays a crucial role, working together with the public sector and looking into educating in these specific areas.
Right. Ladies, I want to actually just go to the audience now and get some questions. Can I just see by show of hand if anybody has a question right now? We have a mic that can go around, but we also, if you want to maybe stretch your legs a little bit, there is a microphone positioned in the sort of the hallway or the passage, if I can call it that. So somebody will come around and get a mic to you. There's a gentleman here. But wow. Let me hold my thoughts and come to you and get the question, and then maybe we'll... Right. So please say your name and perhaps direct your question to a single panelist so that we can do many questions, if that's right. Thank you.
Hello, my name is Finn. I'm a student of sort of digital society, and one thing that is particularly present in academia is the ethics of data sharing. And one important thing I think in this question of ethics is the reciprocity of data sharing, so that everybody on the table really gets the benefits of data sharing. And maybe Nina, how does Google create that environment where the data is being used ethically and where there's also a reciprocity of the benefits?
Absolutely. Okay, let me just collect another 2 or 3, right? Thanks so much for that, Finn. Let's get another question. Yes.
Hi, my name is Benedict, and I have the same question. Thanks.
Okay. Somebody with a different question, and I guess, Nina's got a lot to pick up over there. And I want another 2, just so that it helps with the pace if we collect a few more questions. Does somebody have a mic? Oh.
Just raise your hand and I'll come.
Okay, so I think we're fine. I think Finn sort of asked the question many people wanted to ask. So, Nina, why don't we pick up with you now on that one, the ethics,
Thank you so much, Finn, for this wonderful question. So AI ethics and data sharing and ethics are very crucial when we look into innovation. And the way how we approach this is we're looking into AI being both responsible and together. Both means we're looking into how can we leverage technology and AI addressing the world's biggest challenges. When we look into responsible, we're looking into what are the guardrails, the safety and privacy guardrails that we need to have in place in order to account for any biases, any risks associated with this. And then lastly, when we look into it together, and this is incredibly important also here in the scope of this panel, we need to work, no organization alone can address data sharing or AI, particularly in healthcare alone. We need to look into how can we work together across sectors, across private and public sector to address these challenges. And I'd like to bring a very particular example that we're so excited about and that we recently launched. And this is Google DeepMind's AlphaFold, AlphaFold 3 in particular. Perhaps you've heard about it, or maybe not yet. But this is a very, very, I see nodding from Finn over there. So it's an exciting example of how data for social impact, for the social good, can be created, disseminated, and then used by other entities to create more value out of this. So when we look into AlphaFold, essentially what it does is it lets you predict the shape and the interaction of all living molecules. We started with AlphaFold 2, which focused on proteins, and now we're looking into beyond proteins. And essentially what this does is it enables us to accelerate the speed around understanding biological research fields and also accelerating aspects like drug discovery, computational drug discovery. And just to give you an example or a number on how incredibly exciting this is. So AlphaFold has made it possible for us to create the 3D shape for more than 200 million proteins. And in order to actually predict the shape of these 200 million proteins, when we look into traditional research, this would usually take the equivalent of 400 million years to come up with these shapes. So through our AI model, we've been able to accelerate the pace on this to a couple of weeks. And the reason why this is exciting is why this fits really well to your question is, on the one hand, it's bold. Again, addressing the world's biggest challenges. On the other hand, we're looking to make this responsible. We've been working together with different sectors in the scientific field to truly understand what are the risks associated with this. And then lastly, we're looking into how can we work on this together? How can this accelerate the innovation in the broader community? So we launched a platform which is called the AlphaFold server, which provides access to the 200 million proteins for researchers at no cost to leverage these proteins for their own research. Wow. And up to this date, we know that over 1 million scientists have used AlphaFold already to drive research on areas, for example, cancer prevention. So this is one of the examples where we look into being bold, responsible together, and how this can really help accelerate progress also beyond the private sector.
Great. Thanks for that, Nina, and thank you for the question, both Benedict and Finn. So we have 2 questions now.
Yeah, maybe as an addition to the question and bridging over to Mary, we were talking about the unconnectivity of a lot of people in sub-Saharan Africa. And my question is, how does the African Union maybe perceive this also as a chance to maybe tip the scale a bit of how we can use this data in a more of a public-oriented way, instead of leaving the space more or less to the private sector to kind of engulf these people, just as it has with lots of other people around the world, and using it more as a leverage to make this data publicly available and make it usable for research and other entities that might have another view on developing AI and machine learning for the common good.
Understood.
Thanks.
Thank you, Benedict. I need 2 more questions. I saw some hands here as well. There's one hand here and another here.
Hello, my name.
Yeah, we can hear you. Oh, shame you're getting the feedback.
Hello, my name is Uta Meyer-Hahn. This question also goes to Ms. Bekele. You mentioned that you, with regard to the self-diagnosis usage of Google, etc., and the health information that you can deliver through surfacing good authoritative sources, you've mentioned that in these lines, in these themes that are so essential for people and to provide ethical use of the information that Google surfaces, you give more emphasis and more weight to authoritative sources. Now, I'd like to say just a little bit on that topic because it's so super relevant, as so many more searches actually don't start at Google but also end at Google, where Google is not leading people to links on other pages but actually already providing the results itself, combined with artificial intelligence that actually provides the content that people are looking for. Now, especially in the health sector, maybe we can use this as an example. How do you go about identifying in this dynamic information scape authoritative sources? Maybe even in the African continent, as we are speaking here, do you work together with institutions, institutionalized partnerships? Are there possibilities to onboard at Google as quality information sources? What does this look like in practice? Thank you.
Thank you, Uta. And then one more here. There was a hand, I think the gentleman who I could see.
Yeah, so my name is Al-Hassan Mae from DIPC, Digital Innovation in Pandemic Control Project, a project that is being rolled out in 5 countries, including Africa, where I'm coming from, Sierra Leone. Of course, we've developed the National Digital Health Roadmap, and within the National Digital Health Roadmap, we figured out there is a huge gap in terms of interoperability of the various digital health-related systems in the country, and most of these systems has not been communicated to each other. So my question here is about data sovereignty and integration challenges in Africa. Being that you suggested for countries to be storing the data on cloud servers, I totally agree with you, because this was part of the recommendations UNICEF made to DIPC, the Digital Innovation and Pandemic Project in Sierra Leone, because the government was actually intending to have the data stored on external server. But this one is really cost intensive, and cloud servers are way cost effective and more sustainable as compared to having external server. So now, how can you address the issue of underutilization of the data? Because you made mention about 97% of the data, hair-related data that is being generated, it is currently not in use. I want to know how, and what are the modalities have you put in place to see how best we could make efficient and effective use of the data?
Okay, Al Hassan didn't specify who he wants for that, but Mary and I think that will be for you to take. And let's actually start like this. We'll go with you, Mary, because there was that first question directed at you from Benedict. And then I think let's take Al Hassan's questions and we'll come back to Nina on Uta's question.
Okay, so Christine, thank you, and thank you for the questions. I think, it's very important for us to really look at the core of the issue. We've just learned that 97% of the data is not used. And this is really, and from the African perspective and what we've experienced, every time you go back, you ask the same member state to give you the same data that you never analyzed and never gave feedback to, and therefore they don't understand the value of data. So I think we need to just go back to the basics. Ask ourselves, you already have all this data that you still have not analyzed, that you still have not used, and leverage on the private-public partnerships. That is very important. Because I think for Africa, and I think Sierra Leone, you've just said something. As long as you do not have a strong data analytics workforce, you will remain with as much data. You can collect as much data as digital applications can do, but as long as we are not interpreting that data to tangible actions that means something even to the woman in the farm, that it will tell her, prepare, there is going to be, something, there's going to be an outbreak of something. Even for your chicken, just be ready. This is the environmental conditions that you will expect, get ready. So that lack of preparedness and lack of information, meaning anything for them, gives that challenge in terms of data. And I think we really need to just get back to the basics. When we sit together and collect data, ask ourselves, so what? So what about this data? Because we are now bringing in digitalization, and we've been asking ourselves, is this a panacea? Is this the silver bullet? Or is it an enigma for Africa? What does it mean? You improve efficiency of systems in terms of data collection, but the data does not have any meaning at the end of the day. So I think this is very critical, Nina, even for Google. Can you bring in meaningful data analytics, meaningful AI? Okay, so we use AI. What does it mean? It means that you can be able to predict, you can prepare, you can respond. Why don't governments keep budgetary allocations for disasters? Why? Why don't we keep it? We always wait and we are all running everywhere looking for funding. You've experienced that, right? It's because there's not that predictive modeling in place. There's not that predictive action that, there's going to be floods, and floods come with health issues, cholera or something, get ready. So I think this is the challenge. Data can be made available if at the end of the day, it means something to the member states. It means something. You need to put systems in place. The private sector comes in, sits at the table and says, you know what, you need to do 1, 2, 3, 4, and be ready for this. So that way, there's going to be a very good way of moving actions. I always say, let's call it the digital ecosystem. What is an ecosystem? It's a complete circle. It's not half a circle, it's not quarter circle. It has to be the full circle to mean something at the end of the day. Right. And I think that's what we need to do. Right. If data against disasters, if I'm coming against a disaster, I need to know what that data means and what I need to do to continually push the agenda forward. And really even just to the basic level, to the users, to the women in the farm. We were looking at transhumans being blind spots of health surveillance. Nobody's following the transhuman populations, yet they can move diseases very fast across borders. So the cross-border surveillance is also a challenge.
Right.
I think you've also observed that. So when you talk about surveillance and the cross-border surveillance data collected still doesn't inform the countries on what interventions they need to put into place, I think that is very critical.
Okay.
So let's just go back to the basics before we really progress so hard. Ask ourselves, what do we need to do for governments to open that data to you? It must mean something.
And I'll come to you, Nina, because you have to pick up anyway, and you'll finish
Okay.
off with the Uta's question.
Yeah, I pretty much pick up on agree on what everything you said. I mean, like the data analytics part is very important. I mentioned that we work a lot with that. But I think it's also the 97%. It's not only Africa, it's even when you go to Germany, to Europe. And I think sometimes it's even simpler because we have to change the mindsets. We always say, like in Europe, we're in the third wave of digital health. And what we are totally incapable of is of thinking from the product and from the patient. So sometimes it's super easy. We look at all these data and we just get lost and it's super complicated. But what we fail to do is just look at the problem that we want to fix and work from there and sort of use the data. And that's sometimes so simple and can make a real change. So even here, we're lost because we look at the data instead of looking at the problem and then just working from there.
Yeah. Absolutely.
Thank you very much. Mary, I've been enjoying your remarks also particularly on the climate crisis and how this affects health and how particularly also early warning systems can help in cases, for example, like floods, as you mentioned. When we look into flood forecasting, this is a notoriously difficult topic. The data is largely fragmented, it may not be available, and also the situation is quite complex. When we look into the global south, for example, Africa, it's even more difficult, especially as data might often not be simply available to engage in flood forecasting. So one aspect on how Google, particularly Google Research, is partnering with the private sector is particularly in this flood forecasting field. Google is good with doing predictions, working on AI. So essentially what has happened is that our Google research team, we've created an AI model that enables the prediction of floods, riverine floods, up to 7 days in advance. And more than 80 countries, covering around 480 million people that could be affected by flood incidences. So we've done a great job with creating this global model. But actually we need to work together with the public sector to also engage now in the information. So this is a wonderful example that shows how public-private partnerships are incredibly important. This prediction is great, but people need to act on this. The public sector needs to be aware of it and need to act on this. So thank you so much for bringing up this point. It's a wonderful way to show how relevant it is that we work together.
Yes. And then there was a question from Uta.
So the question was around health information on Google products, for example, Google Search, particularly when we look into providing reliable health information. So the way how we provide access to qualitative information is in two ways. So the majority of the way how we provide access to quality information is algorithmic. So we look into signals, for example, information around the website, on the quality, how the data is provided, on the sources. So we look into algorithmic signals that help us understand what is a high quality or qualitatively relevant website or information to surface on our products. In some sensitive areas, for example, health or crisis response, we look into partnering with organizations in the field, with authoritative organizations, to make this information more accessible. An example is when we are partnering with the World Health Organization in providing information around diseases, on treatment options, on diagnosis information, and similar. We do partner in some instances, but the majority is really focusing on our algorithmic basis.
Okay, thank you for that. I'm just looking out to see if we have any more hands. I see one hand over there and one hand over there. And I think these will be our final questions. Again, just identify yourself and perhaps direct your question to somebody on the panel.
Hello, my name is Monica Amponsa. I'm also with the Digital Health and Innovation and Pandemic Control Project, sponsored by GIZ. As you were talking about capacity building and the need for capacity building, and in terms of the analytics, and particularly within Africa, I guess my question goes to Anna. How do we get, particularly with donors, how do we get them to see the benefit of the capacity strengthening that is needed within the various countries? Many times we are looking at products and applications and systems, but the human resources to be able to do that and then to make it relevant to those within the various countries becomes something that's secondary. So are there ways in terms of what GIZ may look at in terms of donors? How do we make that relevant so that they can understand the need for that capacity building and that it costs to be able to do that? Thank you.
Thanks, Monica. And then we just had one more question here, Catherine.
Yeah, so my name is Moritz, and I'm working also for GIZ. And I would like to deeper more into the safeguards, which were just briefly mentioned by Nina, because we were talking mainly about aggregated data, right? Flood data, etc. But I mean, health data are highly individual, highly sensitive. And I mean, what we learned from the past, especially, companies or also governments can misuse this data. I mean, for example, with Amazon and Siri, like there was the scandal that, not Siri, sorry, it's Apple, but Alexa is listening in the background and then is analyzed, etc. How can we really prevent this data is misused? Because it happened in the past, and I think this is a crucial question.
Okay, fantastic. I think, Anna, those were both yours.
Oh, both you. Okay. So thank you very much, Monica. I was just thinking, and I just thought it was interesting because I thought from GIZ perspective, exactly what you said is something that we are extremely aware of, and this is why we do trainings, for example, on data analytics, and now we're just doing AI trainings for female leaders and politicians in Africa. So perhaps I can ask you back, because from GIZ side, I thought we are extremely aware of this, and this is what we focus a lot on. So I would be, I don't know, perhaps you can. My sense would be, since we are so aware, everybody is aware, but is that not part of the other donor communities? Because I think it's so obvious that, to be honest, I thought this was not a problem, but perhaps you can just elaborate on me so I learn where the problem is, because perhaps you're just narrow-minded because you think it's so obvious.
Yeah. I think maybe it's one for the reference to the broader donor community, to say, you clearly get it, perhaps, how do we get the message across to other donors? But I do want, Mary wants to.
Yeah, I think Anna really, and we've learned a lot from our One Health project with GIZ. It's really about co-creation. That is the key word. Co-creating with the development partner and with you. Because that way you're able to come together and harmonize and move towards a common goal. That has been so good for us, and that's the best way to do it, because at the end of the day, you end up with a product that you're meant to be implementing in a member state, and they're not very comfortable with that. But what we've done in our project, we co-created from the concept note. We worked together with GIZ technical team, and we grew it from what are member states saying and what is GIZ saying. And there's always a common ground where you all grow together and it becomes very seamless. So it's not only for GIZ, but it's for all partners, even when you come to Nina, just moving together, co-creating, co-working.
Right.
And Christine, if you'll allow me, there's something very important Nina talked about, I didn't get the system, but you can do your modeling and you can understand all sorts of predictions and situations. But it would be very good if, Google could think about how to come up with simple, user-friendly, interpretable results for policymakers, not for scientists, not for anybody who can understand this 3D dimensional graphic. We've observed every time you present something to heads of state, the end of the day should be, what does it mean to my people? Because if you look through the telescope, it's all about votes. So the heads of state is more interested in something that will mean something for his people and for his votes. So I think we need to make a paradigm shift from the technical, scientific way to make it more user-friendly and tangible.
Right, so making it user-friendly, but how do we also protect this data from misuse, as the question asked by Moritz?
Yeah.
Does somebody want to tackle that one?
Yeah. So thank you so much on the question regarding how can we protect data, especially around the health space. So health moves at the speed of trust. So that means we can only advance in the health space, particularly around data and technology, if users and organizations trust that we treat this data responsibly. We have a couple of safety guardrails in place, and just to look into this a little bit more in detail. So on the one hand, we look into how can we deploy the highest level of privacy-preserving technologies to ensure that the data is secure throughout our products and services. It's also important to note that we do not share sensitive data, such as health data, with third parties. And we also don't show personalized ads around health information. We have a couple of responsible data practices that we deploy. On the one hand, focusing on our responsible AI principles, but also classical data practices. So for example, you only collect the information that you need for that particular use case and do not go beyond this.
Nina, I'm going to actually maybe cut you off there because we've basically got the last 2 minutes.
Oh, yeah.
And I'm sure Moritz can maybe hop over and get the rest of the point over there. But thank you all so much. The reason why I've cut you short, I just want a final takeaway in terms of a sentence from each of you as we close. I see some more hands are coming up, but we've got to stay true to time here, and we've got 2 minutes. So I'll start with you, Anna, and then we'll go down over there just for the...
Yeah, I think we discussed it all. I keep it with you, Mary. I mean, we need the confidence level and the framework. And I would wish so much, and I think we learned, we discussed, there's so many opportunities out there when we work with data, not only in health. I mean, look at the SDGs, we're totally off track. If we want to get anywhere, also with climate, we need to work with data. We need to evolve. And I would just wish for ourselves that we get the basement of the foundation right, that we get into the opportunity space, because there's so much out there and we need it, because otherwise we fail.
Nina?
Wonderful, thank you so much. So on my reflection, I'd like to focus on data and technology, especially in the health effort, needs to be a collective effort. So we need to ensure that no one is left behind. It's accessible to everyone. And the way how we can promote this is through partnerships. It's just too much of a big challenge to focus on one organization or one particular government to solve the challenges. But we really need to look into how can the public and the private sector work together, also together with academia, civil society, to address these challenges.
Thank you. Mary?
Thank you. Yeah, I think just for us, from the African Union, it's really just, we welcome you to sit at the table with us. Let's co-create, let's partner, let's collaborate, let's share ideas more. And I think from the African perspective, train us how to fish. That is the most sustainable way at the end of the day. Yeah. Thank you very much.
So from that proverb, it's better to teach somebody to fish rather than to give them the fish. So thank you all so much, and thank you for your questions, which really made the case here that this is a multi-stakeholder effort, that everybody comes in here. Civil society's voice is especially important because of the sensitivity of what we're doing. But here it is, there's this low-hanging fruit almost, so to say, that we need to take advantage of so that we're better prepared in terms of our policy responses to these global health threats. Thank you so much, guys, and I guess we can continue the conversation
Thank you.
off the stage. Thank you so much for myself. So Nina, Mary, Anna, thanks so much, and thank you all as well.
Thank you.
Thanks, guys.